What are the 4 possible endpoints of a UK Malay PLAB 2 role-play case? I'm Dr. Aman Arora from Arora Medical Education. Absolutely beautiful day, sunny, hot. Just finished day 8 of batch 008. If you were there, I hope you had a great day. What are the 4 endpoints to be aware of in a role-play case? Number 1, urgent admission. Number 2, urgent referral. Number 3, routine referral. Number 4, handle in-house. Let's quickly break these down. Number 1, urgent admission. This is the case that has to go in or stay in hospital. So if you're seeing them in a GP setting in a role play, you need to get them into hospital. If you're seeing them in ED, for example, you need to keep them in hospital, i.e. admit that patient. It could be somebody who's very unwell. They've mentioned a symptom that needs looking into very urgently. They might have some observation, some examination finding that tells you, I cannot let this person go home. They need to be in hospital. Hopefully that should be pretty obvious from the data gathering that you do. So I've got to be careful with the car, obviously with us. Number 2, urgent referral. Doesn't need admission, doesn't need same day assessment, but there is something in that story that tells you they need to be seen pretty urgently. This includes your suspected cancer referrals within 2 weeks, or your non-cancer urgent referrals, somebody who needs to be seen pretty quickly, not on a routine basis that can take 4, 5, 6, 7, 8, 9 weeks to reach, but someone who needs something doing pretty fast. So it could be suspected cancer within 2 weeks, or non-suspected cancer but needs an urgent review. Somebody unwell but not that unwell that needs admission, for example, symptoms getting worse and they need some kind of urgent treatment or test done, they may fall into category number 2. Category number 3 is a routine referral. So they need to see a specialist, but nothing needs them to go in right now and nothing needs them to go and see them urgently. So it might be a condition like, let's say, NEOA, osteoarthritis. That's getting worse. So you've tried a few things, still getting worse. Maybe a knee replacement might be needed. They will be referred routinely to orthopedics, but nothing is needs to be done today or in the next few weeks. And there might be other conditions like, let's say, someone who has, recurrent ear infections. There's nothing acute about it. There's nothing that needs seeing urgently. You're not worried about a cholesteatoma, for example. So it's going a bit dark. It's going under a whole bunch of trees. But it makes sense that they see someone like an ENT consultant to see, is there anything else that needs doing? That's option number 3. Option number 4 is somebody who doesn't need a referral at all. So if they're in GP clinic, they can just be handled here. If you're seeing them in ED, they don't need admission or seeing a specialist. These might be the kind of more simple things like, mild depression that you can start treatment on in a role play case. It might be something like, that first infection of otitis media that you can treat and give advice to. It might be a viral infection that you can give normal advice to. It might be hypothyroidism that can be treated in-house without seeing an endocrinologist. It might be a review of a chronic condition like diabetes or something where there's nothing acute and you can handle it in-house. These are the kind of things that you can manage at the point that you're at, depending on where you start. So if you bear those 4 endpoints in mind, number 1, acute admission. Number 2, urgent referral, including suspected cancer. Number 3, routine referral to a specialist. And number 4, handle in-house. If you have those endpoints in mind, when you're doing your data gathering, when you're asking your questions, when you're examining that patient, when you're looking at findings, you're quite clear on the fact that is A, B, C, or D. Because I don't want to spend too much time figuring out is it A, B, C, D. I want to make that decision quite quickly and spend my time actually figuring out what the issues are and how can I add to those issues regardless, and how can I manage some of those issues regardless of where they end up in those 4 options. Hopefully this helps. If you come into the academy tomorrow, we'll work more on this. If you come into the academy in the near future, we'll see you then. We'll do lots of work on this. But hopefully this gives you a little bit of a good idea if you're doing role play practice for your UK Malay PLAB 2 exam. Hopefully we'll get to see you at the academy, auroramedicaleducation.co.uk. We'll see you very soon. Have a beautiful day. It's a beautiful evening here in Solihull. We'll see you very soon. #CampusWillPass.